Hi, today we are talking about assessments. We started looking at clinical interviewing skills in terms of setting an environment. So we spent the beginning talking about our listening skills, our direct and non-direct, how we're setting and engaging in a therapeutic alliance with our clients because that's the foundation, that's the backbone, is the relationship between clinician and client. What we need to then do as a clinician is we need to be an investigator. We need to gather research, gather data, and figure out what's going on, right? That's going to inform our diagnosis, that's going to inform our treatment plan, that's going to inform our entire practice, is the information that we gather. And how do we gather information? We gather information during intakes, we gather information during our conversations, but we also use assessments to gather information on our clients. So we want to talk a little bit about what are some common assessments that you might use to gather some data on your clients. So like I said, some of our assessments that we're going to use are informal assessments that are driven by the agency that we work for. So for example, we sometimes have intake assessments that are not necessarily a research-based assessment. It's rather what our agency uses when somebody starts with us, our intake assessments. We might be doing a history, what's your life like been, what were you like growing up? We might do a parental assessment. So what I want to look at and focus on for a little bit right now is some examples of assessments that you might use with adolescents. So depending upon where you work, sometimes the assessment is just something that you're going to do as a counselor and it's going to inform your practice and you're good. Sometimes the assessment is something that you're going to do and then you're going to pass it along to a school psychologist or a psychiatrist or somebody who's writing up an evaluation report and including that in how they're identifying a diagnosis and medication management and things like that. So that's really going to depend upon your agency. What we want to look at is different types of assessments. So some of the different types of assessments that we're going to be looking at are personality assessments, behavior assessments, cognitive assessments. We might be looking at career assessments and vocational interest inventories. And we also might be looking at some brief assessments to look at symptomology. So to start with, cognitive assessments. What might you as a counselor be doing with a cognitive assessment, and why would we care? A cognitive assessment is someone's IQ, right? We're looking at what somebody has IQ, what's their ability level, and then we're also going to be looking at what their achievement level, and we want to look and see if there are any gaps. So that's a lot of what we're going to be doing in schools when we're looking at learning disabilities, when we're looking at, and that really speaks sometimes to people's self-esteem, to their future and things like that. So one of the first places that you're going to be looking is at screeners. You're not going to be doing a full IQ, but you might end up doing a screener. One of the ones that I use pretty typically is a RAT, which is a wide range achievement test. These are research and evidence-based. These are something that there's a copyright and a license. You need to pay in order to use them. You get trained in order to use them. And they're pretty simple. You go through and you ask students or clients questions. You ask them, it comes with a real big book too, but you might ask them to read words out loud and you evaluate whether or not they can read words. Just based, do they know how to pronounce things? You would look at spelling, you look at simple math. And then what that is then you compare their scores to what's the average score for someone their age. And you come up with, are they gifted? So are they very high? Are they average? Or are they low? And that can inform you when you're starting to look at some ability versus achievement gaps. We want to have something that's normed there, something that's really structured there. One of the other things that agencies tend to use a lot, as well as schools, are behavior inventories. And behavior assessments and inventories are things like the BASC, the brief, the Connors. These all look at behaviors and they look, and then those behaviors can give us red flags for things like ADHD, depression, anxiety, some different issues that might come up with students and with children. one of the important things about those is that we look at them across the spectrum. We don't just look at what a self-report of a behavior inventory is. We don't just look at the self. We don't just look at a parent report, and we just don't look at a school report. We look at all three, because when we have a problem behavior, we're going to have a problem behavior across three different domains. We're not going to see and if we only see the behavior and we only see the concern in one area, that's further data too. So that might not lead us to a diagnosis, but it might lead us towards where the issue is. Maybe the issue is in the relationship. Maybe the issue is in the environment, not in the client. So that's going to give us really good data. But when we look at those, we want to make sure that we're collecting data across all three areas and domains for children. So we looked at, so the cognitive would be something like the RAT as a screener. A behavior assessment would be something like a BASC, a brief, a Connors, to kind of pull some things out. There's other specific assessments that could look at ADHD, for instance. There's assessments out there that specifically look towards that. There's assessments that specifically look to depression rating scales, to anxiety rating scales, and these all help us tease out the symptoms that someone's experiencing. These give us a structured way to ask questions, and it norms it against other individuals the same age. So it gives us a great comparison between our client and the average population. So those can be very, very helpful things that can look at specific symptoms. One of the other things that we're going to look at, another form of assessment that is pretty common with adolescents, is a functional behavior assessment. Functional behavior assessments are things that we look at in schools, as well as mobile therapy, BHRS services, like behavior support wraparound services. We'll look at functional behavior assessments. And what those do is we tease out what is a problem behavior for this child. And then we start identifying what are the problem behaviors that this child's experiencing. From there, we look at, are there reasons for this behavior? Is there maybe a medication? Is there maybe a time of day that it happens? Is it maybe always right before lunch when we start getting hungry that we're seeing this problem behavior? We start teasing out what's the environment in which this behavior happens. We start really looking into that. And then we start really tracking the data. And we do in-person observations. And we track and we monitor what's the antecedent. So what happens right before the behavior? What's the behavior? And what's the consequence of the behavior? So we go A, B, C, antecedent, behavior, consequence. And we really start doing observations to gather that information, because all human behavior serves two functions, right? We can kind of boil it down to that when we're doing an FBA. We say all human behavior either seeks to increase our pleasure or avoid pain. So we're doing everything, all of our behaviors, all of our actions are either to gain something or to avoid something. So we really delve into that behavior, the antecedent, the behavior, the consequence. We start mapping that out, and then we start being able to create a plan for a replacement behavior, for changing our behavior. So that would be a functional behavior assessment, which is something that a master's level clinician would be engaging in and doing pretty commonly. One of the other things that we use, we talked about careers, and that's across the lifespan. We might do career and interest inventories. The Myers-Briggs is a really popular, typical one that we would do with a client. That is something that you would have to be trained in. There is a fee that goes along with that training. But the Myers-Briggs can give a lot of insight into personality types and careers that connect to those personality types to help our clients kind of lead really successful, happy, fulfilled lives. We can look at enneagrams, right? Like that's not as based in some of the theory and the research, but even finding out somebody's enneagram type could be an interest inventory that could kind of guide us in some different movements for learning more and exploring more about our clients. And the final kind of assessment that I wanted to bring up is suicide assessments. Suicide assessments are pretty important because suicide assessments give us a structure and a stability for really looking at some hard topics. I think our assessments serve two purposes. Our assessments serve the purpose of protecting the client, and it also serves the purpose of protecting us in terms of liability. So you want to make sure that your suicide assessment is something that you're really comfortable with using, and you use when somebody brings something up. In my role, because I work at a school, I don't work at a hospital, so I do more of a suicide screening. So what I use is I use the Columbia rating scale for my suicide assessments at school. And that's a series of simple questions that I can ask. I can listen for the answer, and then it puts my students into a clear zone where they don't need any outside follow-up. It can put them into a yellow zone where I'm a little bit more worried and we want to do some mental health follow-up with them, or it puts them into a red zone in which I need to say you need to go to the hospital and be evaluated. So those are kind of some typical assessments that you might use in school. And like I said, assessments are really the way in which we're giving structure to our information gathering. We're information gathering about our clients because we want to set that therapeutic alliance. We want to join with our clients. We want to have that unconditional positive regard. We want to have an environment that people feel comfortable to come in and sit down and talk with us. But along with that, we also need to be gathering information so that way we can create a treatment plan that's that's grounded in theory and based in research. And so assessments can give us a structured tool to do that. Thanks so much.